Welcome back to Health Angel Solutions, everyone. In this video, which is a follow-up to earlier ones, we'll discuss both positive and negative indicators that, when used appropriately, can help you determine whether or not you can stop taking your thyroid medication. This will be really valuable information if you are a thyroid patient who doesn't like the notion of taking thyroid medicine forever. Let's start with the positive signs. I've done a lot of research on coming off thyroid medication, and we're just going to go over this in a little more detail. For your information, if you have any of these markers, it is a good thing and indicates that there is a higher chance that your thyroid would return to normal if you were to stop taking your medication. Let's discuss each of these markers individually, and I'll explain what each means as well as the statement's larger meaning. First, if you have been taking thyroid medication for less than 4 years, that is a very positive sign. This essentially means that those who are stopping their thyroid medication after a prolonged period of use are likely in the early stages of their thyroid condition. And that's generally better than if you've had thyroid disease for more than 20 years. That's all it's saying. The next one is that you have a normal free T4 at diagnosis. This is significant because many thyroid patients receive a diagnosis at a different stage of the disease. Therefore, if you are diagnosed early, there's a good chance that fewer thyroid lab abnormalities will be present. This is kind of a follow-up to the previous point about how early diagnosis is better. Now, in the case of a TSH, if your TSH is abnormal, but your free T4 level is normal, which does occur as the disease progresses, then you are simply catching it earlier. This could indicate one of two things. Either you have a severe case of hypothyroidism if your free T4 level is low at diagnosis, or you just discovered your illness a little later. For example, you may have been experiencing symptoms for a number of years before visiting your doctor, at which point the doctor tells you that you have hypothyroidism. Really badly doesn't indicate a poor case. Rather, it indicates that you ought to have received treatment a year ago. So you'll need to sort of work that out once more. The next one is you have a current TSH of less than 1.8. So if you are on thyroid medication being treated and your TSH is less than 1.8, that is a good sign. However, neither of these positive signs nor some of the negative signs mean that you will have to stay on your medication. For this reason, I'm just sort of explaining some of these in a little more detail, because it suggests that your disease state is under control. That's really all we're saying. For example, if we prescribe thyroid medication to you, your TSH should stay stable. This is a good sign because it indicates that there isn't anything else missing. It could be another disease state or alternating thyroid function caused by inflammation or infection in the gland. Either way, that's a good sign. The second is that you're taking a low prescription dose of thyroid medication. The lower the dose, the better, as it suggests that your case of hypothyroidism. The last one here talks about gender, and that is women. Fortunately for you, women have about a 2 times more chance than men of stopping thyroid medication. We don't have a specific cutoff here, but based on what I've seen, it looks like anything less than 50 micrograms of levothyroxine or Synthroid. This would also equate to probably about 3/4 of a grain if you're using something like Armour Thyroid, NP Thyroid, or any other type of NDT formulation. But the lower dose that you're on, the better, generally speaking. The exact reason behind that is unclear. If you made it this far into the video, thank you. These videos take a lot of effort and time to make, so if you enjoyed them, please hit the like button, subscribe to the channel. This goes a long way in helping us grow. That said, back to the video. However, since the majority of my audience consists of women, you already have that one going for you. I should also point out that, although I didn't mention it at the beginning, a lot of this information is still emerging and we're still learning. So this is what we currently know and is subject to change. If that changes in the future, though, it will be good news because it means that more research is being done on the idea of weaning people off of thyroid medication, which is fantastic because it's not necessary for folks to take thyroid medication if they don't need to. Let us now discuss the negative side. if it has Hashimoto's or Graves' disease. Basically, what this is saying is that if you have either of these conditions on an ultrasound, it's usually not a good thing because many cases of Graves' or Hashimoto's do not show up as physical changes on a thyroid ultrasound. In other words, you can have positive antibodies for Hashimoto's, but the condition isn't actually visible on the thyroid gland, which suggests that you likely have a more aggressive form of the disease. The second one is widespread echogenicity and positive TPO antibody. Again, this is an echogenic, the diffuse echogenicity. It's just a way to describe your thyroid gland on thyroid ultrasound. And it just means that it encompasses the entire thyroid gland. So again, don't get confused or alarmed by this lingo. It's really kind of simple. It's just saying, hey, if you have positive TPO antibodies and your entire thyroid gland is impacted on ultrasonography, that's a bad sign. Okay, fair enough. That just means you're probably having more advanced disease if your TSH is greater than 8 at diagnosis. That is a bad sign. This is essentially a follow-up to what we said at the beginning. If your TSH is higher, you are more likely to have an advanced form of hypothyroidism. In other words, the higher your TSH, the less likely you are to be able to stop taking thyroid medication because your disease is more likely to be aggressive and cause irreversible damage to your thyroid gland. The next is a baseline TSH of more than 9. Note that this is not the same as your TSH diagnosis, which we discussed before. Rather, baseline TSH relates to your TSH level while you are on thyroid medication. This simply means that if your TSH is 9 and you take thyroid medication, something is wrong. We're not sure exactly what, but it's not a good sign. Similarly, if your TSH fluctuates a lot and tends to be higher -90 is a fairly high TSH, and you take thyroid medication, that is also not a good sign for your thyroid or your chances of stopping the medication. The second concern is if you were diagnosed when you were young. Since the age isn't stated here, despite my best efforts to uncover it for you, we'll just state that, generally speaking, the younger you are at diagnosis, the worse off you are, and most often. Because if you are diagnosed between the ages of 20 and let's say 50, whatever has been going on in your body for 30 years at this point. Hopefully, many of you listening to this have discovered your disease much earlier and have known about it for less time than, say, 4 or 5 years, as that seems to be a pretty good cutoff range for a positive sign. Lastly, if you have a positive thyroglobulin antibody at diagnosis. Once more, this simply brings up the concept of Hashimoto's and Graves', as this specific antibody might be linked to both. In the instance of hypothyroidism, however, Hashimoto's is primarily the issue. However, as a patient, it's important to understand that, according to conventional doctors, Hashimoto's disease is almost always incurable and will result in permanent thyroid gland damage. If you've been following my channel, you know that's not how I think or believe, which is why I talk a lot about natural treatments and how to incorporate treating your Hashimoto's into our mission. However, you'll also notice that the doctor's prejudice towards these autoimmune diseases manifests itself in these negative signs. These are simply signs. I have a ton of information talking about how to actually stop taking your thyroid medication. If you've looked at these signs and are trying to figure out what to do next, I still advise you to try it with your doctor to see if you can get off your medication. However, don't take this as meaning that you will be able to stop taking it, no matter what, as you can never be certain. You may still be able to stop taking your thyroid medication, even if you exhibit a lot of unpleasant symptoms. If you're interested in doing so, watch my video, which explains how to stop using thyroid medication.